for many years, there's been debate about whether maintenance is going to be effective or not. A number of phase 2 studies have shown that there was potentially improved outcome with maintenance, but it was always hard to tease these out because then there were also some phase 2 studies that showed that maybe there was not a clear benefit. So I think the large study that has kind of put this debate to rest, at least in my mind, is the oral CC486 study. This was a maintenance study using oral CC486, which is an oral epigenetic agent, as a maintenance in patients who had completed their planned induction consolidation and were not going to stem cell transplant. It's really important to know that these are patients who are not going to stem cell transplant. And the reason they were not going to transplant was either because of age, because of no donor, because of financial restrictions, or because of patient preference. So if a patient was able to go to transplant and one thought that he should go to transplant, then the patient should still proceed to transplant. This study did not take patients off transplant. So if for some reason the patient eventually could not go to transplant, which is common, about 30 to 50% of our patients, that's the case, then they were randomized to receive either CC486 or placebo, which is a standard. We would do observation. And this study showed that with the addition of the CC486 as a maintenance after planned induction consolidation in patients who could not make it a transplant, there was a clear survival advantage with a median survival of 26 versus 15 months. And this was maintained at 2 and 3 year follow-up. So this now I think will lead to the approval, hopefully, of CC486 as a maintenance post-induction consolidation in patients with AML who cannot go to transplant, and also kind of establishes that transplant is definitely beneficial. Now, this is the first step. Next questions will look at what about post-transplant maintenance, potentially with CC486 or with other approaches. What about maintenance in patients who can go to transplant? Could you potentially reduce the need for transplant by doing maintenance? That's a big question and a completely separate study that will have to be done.